Okay, so you want to talk about hidradenitis suppurativa. You sent us a ton of research. Our listeners are really looking for answers about HS.
Yeah, there's a lot of confusion about it still.
So let's jump right into this deep dive.
Right.
Explore the symptoms, risk factors, and most importantly, what's the latest on treatment and management?
What I always find really interesting is that many people, even some doctors, they initially mistake HS for severe acne or boils, but
Oh, really?
yeah, it's way more complex than that.
Yeah, it seems like from what I've been reading from your notes, it's not just like what's happening on the surface of the skin. It's like
Mhm.
there's a whole world going on beneath the surface as well.
Exactly. You've got these painful, deep-seated lumps and abscesses, and in some cases, you even get tunnels that form under the skin. They're called sinus tracts.
What?
Yeah, there are these channels that actually connect these abscesses.
Wow. Okay, so that's definitely not something you'd see with a typical pimple.
Right.
And from what I've read, it's not a one-time thing. This seems to be,
A recurring issue for most people.
yeah, HS kind of follows this frustrating cycle of flare-ups and remissions. You might have a period where your skin's pretty clear, and then suddenly, bam, you're hit with another painful flare-up.
It's like a constant game of whack-a-mole,
Yeah,
but with way higher stakes.
absolutely.
Okay. Now, you mentioned that even experts are still a little bit puzzled about the exact cause of HS.
Yeah.
But one thing is for sure, and it's something you specifically highlighted in your notes, it's not about poor hygiene.
Absolutely. That's a myth that needs to be busted. It's an inflammatory condition. It's not caused by dirt or lack of cleanliness.
Right, so it's even more frustrating in that sense because it's not something you can simply wash away. So if it's not hygiene,
Mm-hmm.
what are the risk factors that seem to play a role here?
Mm-hmm.
I noticed you flagged some studies about genetics and hormones.
Yes, those are both key areas of research. Family history is a significant risk factor. So, if you have a close relative with HS, your chances of developing it are higher. And it's especially common in women. Oh,
Often appearing after puberty, so that kind of points to a potential hormonal link.
okay, so genetics, hormones might be involved. But are there any lifestyle factors that seem to either trigger or exacerbate HS?
There are. There are a few that pop up constantly in the research. Obesity, for example, is strongly associated with HS.
Okay.
And smoking is another big one.
Makes sense. They both can, both obesity and smoking can contribute to inflammation in general.
Yeah.
So it's not surprising to see them linked to an inflammatory condition like this. And what about stress?
Yes.
I know that's often a trigger for other skin conditions.
Stress is huge for many people with HS.
Really?
Yeah, it can disrupt that delicate balance of your immune system, make you more susceptible to flare-ups.
So we're kind of seeing a pattern here. Genetics, hormones, lifestyle factors, they all seem to contribute to this complex puzzle of HS. Now, let's say someone listening suspects they might have HS. What should their first step be?
First step, see a dermatologist. They can examine your skin, assess your symptoms, and rule out any other conditions that might look similar.
Got it.
There's actually a specific grading system called the Hurley staging system that dermatologists use to classify the severity of HS.
Okay, so getting a proper diagnosis from a dermatologist is key. And then this Hurley staging system helps determine the best course of treatment, I'm assuming.
Exactly. Treatment's going to vary depending on how severe the HS is and what other factors might be contributing to it.
Okay, so let's get into the treatment side of things. You sent us a ton of information on various treatment options. Where do we even begin? What's the typical starting point for someone newly diagnosed with HS?
Well, it often starts with lifestyle modifications, addressing those modifiable risk factors that we've talked about. So weight management, smoking cessation, and stress reduction, those can have a significant impact on the frequency and severity of HS flare-ups.
So before we even jump into medications or anything like that, it's really about taking control of those lifestyle factors that you can actually influence.
Exactly. Those lifestyle changes, they're not just nice-to-haves. They're often fundamental to managing HS effectively.
I'm seeing that emphasis in a lot of this research you provided. But of course, medication is often a necessary part of the treatment plan as well.
Right.
So let's unpack that a bit. What are the main types of medications used for HS and how do they work?
Well, one of the first lines of defense is often antibiotics.
Okay.
They can be topical creams or oral forms, and they help manage the bacterial infections and inflammation that are often associated with HS.
Okay, so antibiotics targeting that infection and inflammation. But what I'm seeing in these studies is that antibiotics aren't always a long-term solution.
That's correct. They can be helpful for managing those acute flare-ups, controlling bacterial growth, but they're not typically a cure.
Okay.
For longer-term management, there are other options like hormonal therapy, which can be particularly helpful for women whose HS seems to be linked to their menstrual cycles.
Interesting. So targeting the hormonal fluctuations might help break that cycle of flare-ups for some women?
Yeah.
Now, I also noticed you highlighted a newer category of medications called biologics.
Yes.
There's a lot of buzz around these, especially a drug called Humira.
Right.
What makes biologics different from other HS treatments?
Biologics are a really fascinating development in HS treatment.
Okay.
They work by targeting specific pathways in the immune system rather than just broadly suppressing inflammation.
So it's like a more precise, targeted approach?
Exactly. Humira, for example, is what's known as a TNF-alpha inhibitor. TNF-alpha is a protein that plays a key role in inflammation, and by blocking its activity, Humira can help reduce the inflammation associated with HS.
It sounds like biologics are really changing the game for some people with HS, but I imagine they're not without their downsides.
That's true. They're powerful medications, and they can have side effects. They're also typically more expensive than other treatment options.
So it's all about weighing the potential benefits against the risks and finding the right approach for each individual.
Precisely. And that's why it's so important to work closely with a dermatologist who specializes in HS. They can really help you navigate those various treatment options and make informed decisions based on your specific needs and circumstances.
It sounds like finding a knowledgeable dermatologist is key in this whole process.
It is. It's a partnership. Your dermatologist can guide you through the different stages of treatment, but it's also important for you to be an active participant in your own care.
Okay. So we've covered a lot of ground here, from the mysterious nature of HS to the importance of lifestyle changes and the range of medical treatments available. But before we move on, I want to make sure we're not glossing over the emotional side of things. You flagged several studies about the impact HS can have on mental health. It's not just a physical condition, is it?
It's not. The physical pain and discomfort of HS are one thing, but the emotional toll can be just as significant. Imagine dealing with these recurring painful flare-ups. Things that can make even simple things, like wearing certain clothes or going out in public, incredibly difficult. It's not surprising that anxiety, depression, even social isolation are really common among people with HS.
Wow. So in our next segment, let's dive into the emotional and psychological aspects of HS and explore what resources and support systems are available.
I'm looking forward to it. There's a lot we can unpack there.
This is an area you seem particularly interested in based on the sources you sent over.
Absolutely. Welcome back.
So in the first segment, we talked about some of the physical challenges of HS, the pain, the discomfort, the unpredictable nature of the flare-ups. But, I think it's crucial to acknowledge that those physical challenges often lead to some serious emotional and psychological struggles as well.
Absolutely. Living with a chronic condition like this, it can really take a toll on your self-esteem, your body image, your relationships,
Right.
really your overall sense of well-being. And it's not uncommon for people with HS to experience anxiety, depression, or even social isolation.
Yeah, and one of the articles you sent me, it really resonated with me, and it was talking about the hidden burden of HS, the emotional and psychological distress that often is invisible to others, but it's very real to those living with it.
It's a hidden burden because, well, symptoms can be so private,
Yeah.
right? It's not always something people, feel comfortable talking about. And that can lead to feelings of shame, embarrassment, loneliness.
Yeah, it's like carrying around the secret
Mm-hmm.
that you feel like you can't share with anyone.
Yeah, and that's why it's so important to break the silence. We have to start talking about the emotional and psychological impact of HS.
Right.
I think the more we talk about it, the less stigma there's going to be,
Yeah.
the more support people will feel comfortable seeking.
Yeah, absolutely. And you highlighted several support groups, online forums specifically for people with HS.
Mhm.
I imagine that those can be really helpful in terms of connecting with others
Oh, absolutely.
who truly understand what you're going through.
They can be lifelines. you
Yeah.
know. Knowing that you're not alone in this journey.
Right.
It can be incredibly empowering. These groups provide that safe space to share experiences, exchange tips, offer encouragement, or even just to vent about the frustrations of living with HS.
Yeah, finding your tribe,
Yeah.
people who get it. And beyond kind of that peer support aspect, are there any professional resources that you recommend for addressing the mental health challenges?
Therapy can be incredibly beneficial.
Okay.
A therapist can really help you, develop those coping mechanisms for dealing with the anxiety, stress, depression that so often accompanies HS.
Right.
Um, Cognitive behavioral therapy, CBT,
Okay.
has been shown to be really, really effective for managing chronic conditions.
And CDT is all about changing those negative thought patterns and behaviors, right?
Exactly. It's about recognizing those negative thoughts that often pop up when you're dealing with a challenging condition like HS, and then learning how to reframe them in a more positive and constructive way.
Right, right.
And of course, if you're feeling overwhelmed or struggling to cope, don't hesitate to reach out to your doctor or a mental health professional.
It's okay to ask for help.
Absolutely.
There's no shame in it.
Yeah.
Now, shifting gears a bit, we talked about kind of the emotional side of things. I know you're also really interested in kind of the practicalities of living with HS, managing the symptoms, navigating daily life, those sorts of things.
Right.
What are some of the top tips that you've come across in your research?
Well, one of the most important things is to identify your triggers
Okay.
and try to avoid them as much as possible.
Yeah, we touched on this a little bit in the first segment, but I'd love to dive a bit deeper.
Sure.
So what are some common HS triggers, and how can people go about figuring out what their personal triggers are?
Triggers can vary so much from person to person, but some of those most common culprits include stress, certain foods,
Oh, okay.
heat and humidity,
Okay.
tight clothing,
Mm-hmm.
friction, even some medications.
So it's like a detective game.
It is.
You're trying to track down those triggers.
Yeah.
Are there any tools or strategies that people can use to make this process a little easier?
Absolutely. Keeping a symptom diary.
Okay.
It's one of the best things you can do. Every time you experience a flare-up, just jot down, what you were doing, what you ate, what you were wearing, how you were feeling emotionally.
Okay.
Over time, you'll start to see some patterns and connections.
It's about becoming a data analyst for your own health.
It is.
Yeah.
And once you have a better understanding of those triggers, then you can start to make adjustments
Okay.
to your lifestyle and your habits to try to minimize their impact.
So, for example, if you notice that, dairy products always seem to trigger a flare-up,
Right.
you might try eliminating those from your diet and seeing if that makes a difference.
Exactly.
Or if stress is a big factor, you might explore stress management techniques like yoga, meditation.
Right. And if certain fabrics seem to irritate your skin, you might switch to those loose-fitting, breathable clothing made from, natural fibers like cotton.
Makes sense.
Yeah, it's about making those small but significant changes that can really have a big impact on your overall well-being.
So tracking your triggers,
Mm-hmm.
making those lifestyle adjustments, those are key. What other practical tips stand out to you?
Well, gentle hygiene is really, really crucial.
Okay.
And this is kind of counterintuitive for some people because, with traditional acne, you might think, okay, I'm going to scrub. I'm going to exfoliate,
Right.
try to clear things up. But with HS, that can actually make things worse.
So no harsh scrubs or abrasive cleansers. What's kind of the recommended approach?
It's all about being gentle.
Okay.
Use a mild, fragrance-free cleanser.
Okay.
Lukewarm water, soft washcloth, pat your skin dry.
Yeah.
Don't rub.
Yeah, you're treating your skin like it's delicate, like a baby's skin.
Exactly. And when it comes to clothing, like we mentioned earlier, choosing those loose-fitting styles made from breathable fabrics, avoiding that tight clothing, especially in areas that are prone to flare-ups, can really help reduce that friction and irritation.
Makes sense. And I imagine moisture-wicking fabrics are a good idea, especially for people who live in hot, humid climates
Absolutely.
or sweat a lot.
Yeah. Keeping those areas dry is essential.
Okay.
And if you do happen to have a flare-up, there are a few things you can do to help ease the discomfort.
Okay, let's talk flare-up management.
Yeah.
What are some go-to strategies for those moments when you're feeling that pain and inflammation?
Warm compresses can be incredibly soothing.
Okay.
They help increase blood flow to the area,
Uh-huh.
which can promote healing and reduce inflammation.
So good old-fashioned heat therapy.
Yeah.
What about over-the-counter pain relievers? Are those helpful?
It can be. Ibuprofen, acetaminophen.
Okay.
Those can help manage pain and reduce inflammation. But, always check with your doctor before taking any medications.
Right.
Even over-the-counter ones, just to make sure they're safe for you.
Good advice. And what about topical treatments?
Yeah.
I know there's all sorts of creams and ointments out there for skin conditions.
Right.
Are there any that are particularly helpful for HS?
Yeah. Your dermatologist might recommend a topical antibiotic or antiseptic to help control bacterial growth,
Mm-hmm.
prevent infection. And there's some over-the-counter options, like hydrocortisone cream,
Okay.
which can temporarily relieve itching and inflammation.
So it's about having a well-stocked first aid kit for your skin, essentially.
Exactly.
Yeah.
And remember, if a flare-up is severe or it doesn't seem to be improving with home care,
Mm-hmm.
Reach out to your dermatologist.
Always better to err on the side of caution
Absolutely.
and get professional advice.
Now, let's shift our focus a little bit to the future of HS treatment.
Okay.
You sent over some fascinating research
Yeah.
about cutting-edge developments, breakthroughs. I'm eager to hear what you've uncovered in that area.
We've covered so much in this deep dive, everything from the science behind HS to practical strategies for managing it.
We have.
But I'm really excited to get into this. You sent over all these research articles on what's coming next for HS treatment.
Yeah.
And you seem really excited about it.
There's a lot happening in the research world that gives us a reason to be optimistic.
Okay, good.
For a long time, HS was kind of a neglected condition, but thankfully that's changing.
Yeah, it feels like there's some momentum building, both in terms of awareness and developing new treatment options.
Absolutely. And one area that's particularly promising is the development of new biologics.
Okay, biologics. Again, we talked about them a bit in the first segment, but I'm ready to geek out.
Yeah.
What's so groundbreaking about these medications and what's in the pipeline?
So biologics are designed to target very specific pathways in the immune system that are involved in inflammation. And the more targeted we can get, the better the results, and hopefully fewer side effects.
It's like using a scalpel instead of a sledgehammer.
That's a great analogy.
Right.
And there are several new biologics in clinical trials right now that are showing a lot of promise for HS.
Wow.
Some of these target different inflammatory pathways than the existing biologics,
Okay.
which means they might work for people who haven't responded to other treatments.
That's incredible.
Yeah.
It's like opening up a whole new arsenal of treatment options.
Exactly. And beyond new medications, there's also a lot of excitement about personalized medicine.
Personalized medicine, that's where it gets really futuristic.
I know. Imagine a world where your treatment is tailored to your unique genetic makeup, your immune profile.
Oh.
Researchers are studying how variations in genes and immune responses can influence how someone responds to different HS treatments.
So instead of this one-size-fits-all approach, it's about finding the perfect treatment for you,
Yes.
based on your individual biology.
Precisely. And that level of precision could be a game changer for people with HS.
Wow.
It's still early days, but the research in this area is moving so quickly.
Okay.
There are already genetic tests that can help predict how someone might respond to certain biologics, which helps guide those treatment decisions.
So new biologics, personalized medicine, it sounds like the future of HS treatment is moving in a really exciting direction.
It really is. And even beyond those specific advancements, there are some broader trends in research that are really encouraging. For example, there's a growing recognition of the importance of early diagnosis and treatment.
Right. The earlier you catch it and start managing it, the better.
Exactly.
Yeah.
And there's also an increasing emphasis on the role of lifestyle interventions, like weight management, diet modifications, stress reduction, in conjunction with those medical treatments.
Yeah, it's about taking a holistic approach,
Absolutely.
addressing all those factors that might be contributing to HS.
Speaking of holistic approaches, I know you're a fan of some alternative complementary therapies.
Are there any that seem to be helpful for HS?
There's some promising research on the use of acupuncture and mindfulness-based practices like meditation and yoga for managing HS symptoms
Okay.
and improving quality of life.
So incorporating some of those mind-body techniques can potentially make a difference.
It seems so. They can help reduce stress, which we know is a major trigger for a lot of people with HS,
Right.
and they can help manage pain, improve sleep. All of those things are really important for overall well-being.
It's about taking that proactive approach to managing your health and well-being, using all the tools available to you.
I love that.
Yeah.
And I think that's what's so empowering about all of this research. It's giving people with HS more options, more hope, and more control over their lives.
It's like finally having a roadmap after being lost in the wilderness for so long.
I love that. That's a great way to put it. And speaking of roadmaps, I think it's important to remember that even with all these advancements, the journey with HS, it can be long and winding. There will be good days and bad days, and it's okay to not be okay sometimes.
Absolutely. It's a chronic condition.
Yeah.
It means it's something you learn to manage, not necessarily cure.
Exactly. And that can be challenging.
Right.
But You're not alone in this.
Right.
There's a whole community of people out there who understand what you're going through, and there are so many resources available to help you navigate this journey.
Finding your support system, whether it's online forums, support groups, connecting with other people with HS in your local community.
Yeah.
That's great.
And don't underestimate the power of self-care. Taking care of your physical and emotional well-being, so important when you're living with a chronic condition.
So things like getting enough sleep, eating a healthy diet, managing stress, finding those activities that bring you joy.
It all matters. And that's actually what I want to leave our listeners with today. We know stress can be a major trigger for HS.
Right.
So I want to challenge you to think about one small thing you can do today to nurture yourself, to reduce your stress levels, and to show yourself some kindness.
I love that. It could be something as simple as taking a walk in nature, listening to your favorite music, or just spending time with a loved one.
Exactly. Even those small acts of self-care can have such a big impact on your overall well-being.
It's been an incredibly insightful deep dive.
It has.
We've learned so much about HS. To our listener, we hope this has empowered you with knowledge, hope, and a sense of community. Remember, you're not alone in this. Keep learning, keep advocating for yourself, and keep connecting with others.
And never underestimate the power of even the smallest act of self-care.
Thank you for joining us on the deep dive. We'll see you next time.